Hi, I'm Dr. Mike Milligan. I'm here with Dr. Dan Sindelar of St. Louis, one of the co-founders of the American Academy for Oral Systemic Health and current board member. Dan, thanks so much for being with us here today.
Thanks for having me, Mike.
Yeah, so tell us about the AAOSH, the American Academy for Oral Systemic Health, and its early days and how far we've come, because it is growing quickly.
Sure. Well, this as you know, is a dream of all of ours. We started working on this a few years back, and we could see the need for this. We needed to bring all sides of healthcare together. And the studies are mounting, and the importance of oral health and how oral health directly relates our general health. Right. So to start, we just knew we needed to bring people together, and that's our mission. Right,
and so this whole concept started several months ago, a few years ago, and then at the end of September, we had the first meeting of 37 people. You were instrumental in helping to bring that together, and we elected the board there, you being a board member, and then it's come a long way since. Give us a little bit of the history of that.
Well, to see the progression of this group has been great fun, because it's building momentum, incredible momentum, and that part is satisfying for all of us, but also just it's a passionate part of our lives. We have now, I believe, over 250 people attending a current meeting. Right. And and the reach is so far out past us. It's been really great.
Right. We've got over 300 paid members, over 250 people at the current meeting that we're at right now. And it's not only dentists. The interesting thing is many physicians from around the country are here as well.
Absolutely.
And we're partnering with physician organizations, and so we're really bringing the medical community together with the dental community for the benefit of our patients.
Absolutely.
Yeah.
As you know, yesterday, our first day of the meeting involved the Bale-Donine method. We had Brad Bale and Amy Donine, and a preventive cardiology protocol, and it ties directly into oral health. And then we had Dr. Tom Neighbors from Oral DNA give us the link and the connection, and with the salivary diagnostic testing.
Now, Dan, tell us some of the benefits of being involved with AAOSH.
Sure, thank you. One of the many has been the individuals I've come in contact with. And one in particular, well, my new mentor, not my new mentor, my mentor in the medical profession is Dr. Lloyd Rudy. He's an incredible individual. He has accomplished so much. And as you know, he's considered one of the top cardiac surgeons in the history of mankind.
Absolutely, yeah.
And then also, and I met him because of being a board member, I was invited to a preceptorship in heart attack, stroke, and diabetes prevention in February, and that has changed my life in many, many ways.
You're like one of the 20 or 30 dentists in the country that are certified in that preceptorship.
Absolutely.
Yeah. And
it's a real in-depth approach to reduction in inflammatory disease, and then to have an organization, the AAOSH organization, that's specifically directed towards that area. It's just a very important part of my professional career. So then I find myself just changing everything I've done in my practice and my approach to my profession.
Right. It just influences everything you do now with your patients.
Absolutely.
As you bring in all of this oral systemic information.
Absolutely. The next step for this for me is I'm going to be participating and attending the Cleveland Heart Lab Symposium at the Cleveland Clinic in September, and I'm very excited. They're bringing all areas of healthcare together to talk about the prevention of heart attack and stroke, and that's going to be quite
exciting.
It's very exciting.
Right. So what do you see for the future of this organization? I mean, we're on a growth curve like this.
Absolutely. Some of the things we've worked out recently, we now are joined with the AAPP, the American Academy of Private Physicians.
Right.
We are actually, we already have a meeting set up in Boston the end of September where the two academies are going to do a joint meeting. So we are actively bringing all sides of healthcare together so we can reduce the problems of our patients and increase the wellness in our country.
You bet. So how do we get in touch with this organization, Dan?
Well, thanks for asking. The best way is our website. We have a great website. It's been developed by a dear friend and a friend of yours and mine,
right.
Dr. Lee Osler. But if you can go to www.AAOSH.org, and it's all on there, and we update it. And I would strongly suggest signing up for our newsletter. We have a monthly newsletter. It has current articles. We are bringing articles from the medical and the dental profession and tying it all together.
Right. And then any last words before we close here today, Dan?
Well, I just want to tell you that this is one of the most passion-filled groups you'll ever become a part of. I strongly suggest people look into this. It is changing not only the face of dentistry, but the face of healthcare.
All right. Well, thanks so much for being with us today, Dan.
Thank you, Mike.
Okay.